이번 2부작 방송을 통해 미국 캘리포니아주 벌린게임의 존경받는 내과 전문의이자 중독의학 전문가인 윌리엄 그레시를 모시고 오피오이드와 통증 치료 및 약물 중독의 유형에 대한 그의 전문 지식을 나눌 수 있게 되어 영광입니다. 내과의로서 폭넓은 경험을 갖춘 글래시는 벌린게임 병원에서 알코올 및 약물 치료 프로그램의 의료팀장으로 30년간 헌신했습니다. 그의 별명은 포옹하는 의사이며 사랑의 치유력과 호응과 면역체계 간의 지피라고 강연한 바 있습니다. 이 훌륭한 의사는 현재 벌린게임에서 글렌 메디컬 의료진과 함께 일하고 있습니다. 치료나 예방을 위한 약물은 제대로 복용하지 않을 경우 부작용을 초래할 수 있습니다. 약물을 올바로 복용하려면 최대 효과를 위한 약물의 적절한 용법에 대해 숙련된 의료 전문가의 처방과 조언이 필요합니다. 오피오이드는 통증 조절을 위한 처방약의 일종입니다. 미국 정부 기관인 국립약물남용연구소에 따르면 오피오이드 진통제는 의사의 처방에 따라 단기간 복용하면 일반적으로 안전하나 통증 완화와 함께 다행감을 유발하기 때문에 오남용될 수 있으며 오피오이드 진통제를 잘못 사용하면 중독이나 가다 복용 및 사망으로 이어질 수 있다고 합니다.
It used to be called opiates, but now it's called opioids. It means opium-like. So the original is the opium that came from the poppy plant in the Far East, and anything that is similar to opium is opioid, so it's opium-like. And that includes all of the scheduled narcotics, morphine, dilaudid, heroin, Vicodin, codeine. All of these are opioids because they're similar in way they affect the body as does opium.
오피오이드는 주로 심한 통증을 완화시키기 위한 진통제로 사용되는 몰핀과 같은 화학물질입니다. 그러나 통증 관리를 위한 오피오이드의 사용은 내재된 위험이 있습니다. 무엇이 사람을 이러한 약물에 중독되게 만드는 걸까요? 글래시의 견해를 들어볼까요?
Well, I think it's important at this point to define addiction. Addiction is commonly misunderstood. People who take opioids on a long-term basis become physically dependent. Physically dependent is not addiction. Physically dependent means that if you stop this product or products, you will go into withdrawal, and that is not addiction, that is dependence. Addictive disease is associated with aberrant or abnormal behavior. Someone who's being treated for chronic pain, and there are millions of Americans nowadays who are being treated for chronic pain, and they're very fearful of being an addict. They will never, ever become addicts unless they start doing aberrant behavior. What is that? Buying it on the street, going to multiple doctors and lying about what you're getting, going and taking it from your neighbor or from your sister. So the behavior pattern is crucial to have addictive disease.
우리는 글래시에게 미국의 오피오이드 중독 수준과 이 문제에 대한 그의 염려에 대해 질문했습니다.
There's a lot of press and a lot of publicity, and it's in the news all the time on television and print, and politicians talk about the opioid crisis in the United States. There are localized pockets of these crises, and it's not common in most of the United States, except in small areas, and it's really a select population. There's an article very well done in one of the leading national internal medicine magazines in September of 2017, the Annals of Internal Medicine. And they interviewed 57,000 people around the country. That's a lot of interviewing. And basically, if you're over the age of 50 and you're reasonably well educated, the chance of being an opioid addict or misusing it is very, very low.
만성 통증을 위한 이 오피오이드를 대체할 의약품이 있습니다. 대한통증학회지에 실린 한 논문에 따르면 아스피린, 이부프로펜 등의 비스테로이드 항염증제, 즉 엔세이즈는 통증 조절을 위해 처방되는 비오피오이드 진통제인데요. 오피오이드보다 저렴하고 비습관성 약물이긴 하지만 이 약의 사용에도 상당한 단점이 있습니다. 글래시는 왜 이러한 엔세이즈 대신 오피오이드를 처방하는지 설명합니다.
And I talk to patients who are afraid of being addicted, and I tell them that you're not going to become addicted unless you have aberrant behaviors with it. But the nonsteroidals can cause liver disease, kidney disease, and sometimes irreversible, and also internal bleeding, GI hemorrhaging, which requires potentially transfusions and surgery. On the other hand, opioids can cause physical dependence, which is not addiction, which means you can't stop it suddenly. You have to work with your doctor to taper off. And the other big thing is constipation. So I prefer constipation for my patients compared to GI bleeding, kidney failure, and liver failure. If they have pre-existing addictive issues with alcohol or drugs, these people have to be handled very cautiously. And as an addiction medicine specialist, I feel comfortable. But for the average physician out there who's dealing with someone with chronic pain who has alcohol or drug history in the past, you have to be very, very, very careful in knowing who your high-risk patients are. And you got to treat them very, very differently.
통증 관리에는 많은 치료법이 존재하기에 약물 치료에만 의존할 필요는 없습니다. 글래시가 이에 대해 설명합니다.
Oh, there are so many alternatives to pain management. The list is enormous. And the unfortunate thing is most of the insurance companies won't cover them. There's acupuncture, acupressure, all sorts of different body modalities work, Feldenkrais, Alexander technique, and there's all sorts of mental health things, group therapy, cognitive behavioral therapy, biofeedback. There are so many different modalities. Not all of them are good for every patient, and you need to individualize.
최근 많은 이들이 통증 완화를 위해 명상을 활용합니다. 내면을 가나는 명상 또한 장기적인 특정 질환을 예방하거나 관리하고 해결하는 또 다른 방법입니다.
Yeah, meditation is excellent. There's a lot of studies to show it releases natural endorphins, which are the body's own opioids that are released by the brain, just getting into a relaxed, contemplative mood and letting everything quiet down. And using guided imagery goes along with the meditation. It's also an excellent modality. That is something that's often done in community centers. You don't need a trained professional like a chiropractor or an acupuncturist.
윌리엄 글래시와 중독 의학에 대한 더 자세한 정보는 다음을 방문하세요.
gladmedical.com
귀중한 시간을 내어 우리에게 오피오이드와 통증 관리에 대해 알려주신 글래시에게 진심으로 감사드립니다.